Hello, I'm Dr. Chris Marshall. I'm a primary care physician in Parsons, Tennessee, and today I would like to talk to you about diabetes, specifically type 2 diabetes, and a few critical points about how you can manage your diabetes more effectively for better health. So let's start by understanding what type 2 diabetes is. So type 2 diabetes is a chronic condition that affects your body's ability to regulate and use sugar or glucose as fuel. So this is a long-term condition that results in too much sugar circulating in your bloodstream. Type 2 diabetes is also referred to sometimes as adult onset diabetes. That has kind of fallen out of favor recently as actually younger people, much younger people, have started to develop type 2 diabetes. That would be in contrast to type 1 diabetes. With type 1 diabetes, you don't make insulin. Something damages the islet cells in the pancreas, which is where insulin is typically made, and you are no longer able to make insulin at all. And in those cases, type 1 diabetics always have to have insulin. So they will typically be on an insulin pump or insulin shots, and that'll be for their entire life. Type 2 diabetes develops because of insulin resistance. So continuously elevated levels of insulin in the blood from usually too many carbohydrates, too much carbohydrate intake over a long period of time, typically decades or more, and then you become resistant to insulin, so the insulin you have is not enough, or you can't make enough insulin to maintain a normal blood sugar level. And so it is similar to not having enough insulin because your body can't respond properly to the insulin that's there because it's resistant to it. The body starts to ignore the insulin. It's had enough, too much for too long, and it starts to revolt. And then your sugar starts to go up. That's typically, again, a long process that takes many years to develop. And so sometimes patients will say to me, "Well, doc, how did I become diabetic overnight?" You didn't. Type 2 diabetes anyway. You developed that over a period of time, and then eventually you crossed a certain line with blood testing, and now you're diabetic. And that's why we also use the terms pre-diabetes or borderline diabetes. I personally don't like the term borderline diabetes. I think it's misleading. It is a continuous process. It's a process of insulin resistance. Insulin levels start to creep up to maintain a normal blood sugar, and then eventually you just can't make enough insulin to maintain those normal blood sugar levels, and that's when we say you're diabetic. And that is defined a few different ways. Usually blood sugar over 200 at any point, hemoglobin A1C over 6.5%, fasting blood sugar levels over 125. There's a few other things we look at, but those are the main criteria to diagnose type 2 diabetes. So going back to insulin. Insulin produced in the pancreas, it helps move sugar from the blood into the cells, and in diabetes that process is disrupted. It's not able to take place because the insulin is there, the cells just don't respond to it, and then you can't get that blood sugar out of the bloodstream, the levels maintain high. So the first step in the development of type 2 diabetes is this insulin resistance. It means that your cells don't respond as well as they should to the insulin that's in your body. They can't easily take up the glucose from your blood. They want to, they just can't because they're waiting for that insulin to tell them to, and they're become resistant to it. As a result, pancreas produces more and more insulin to maintain those normal blood sugar levels, and when you just can't make enough insulin, then your sugar starts to get significantly elevated, and we say that's type 2 diabetes. This leads to a significant buildup in glucose in the bloodstream, and that causes all sorts of problems. It's not just the glucose in the bloodstream that causes problems. This leads to lots of inflammation. There's other factors. We refer to it as a metabolic syndrome. Several factors can actually increase your risk for type 2 diabetes. Obviously, being overweight is a big risk factor. Sedentary lifestyle, no significant exercise. Genetics is a big part of it. You inherit those traits from your mother and father. Age is also a risk factor. Typically, over age 45, you start to see an increased risk. Ethnicity can also be a risk factor. During pregnancy, women also have an increased risk of developing what we call gestational diabetes. Polycystic ovarian syndrome, or PCOS, can increase your risk for diabetes. So those are some risk factors. It's very important that you determine if you have diabetes early. So early detection is key. Some of the signs that you might be developing diabetes are an increased thirst. So you're thirsty all the time, urinating a lot. So if you have to pee constantly, increased appetite, you feel ravenously hungry all the time. That can also be a sign of diabetes. Fatigue, blurred vision, slow healing. Sometimes you can get neuropathy or like a tingling, burning sensation in the fingertips or in the toes. That can be a sign. All those things, I would encourage you, if you have those, to discuss those with your doctor. They can be signs of diabetes. Obviously, they can be signs of other diseases. But if you're having some of those or many of those problems, I would definitely discuss that with your doctor and get their opinion. Understanding how type 2 diabetes develops helps in recognizing the importance of lifestyle choices and the need for regular monitoring of those at risk. It's not just about managing the condition, but also about preventing or delaying its onset. And actually, in many cases, you can reverse type 2 diabetes through proper diet, healthy lifestyle, exercise, things like that. You can actually reverse it. The perfect treatment for type 2 diabetes is diet. Food is medicine. So what about diet? So some diet tips are, you want to incorporate a balanced diet rich in fiber, lean protein, and healthy fats, such as olives and avocado. Limit sugary and processed food. Exercise is another strong recommendation. You want regular physical activity, like brisk walking. It doesn't take a whole lot. Just simply brisk walking for 30 minutes a day can help improve blood sugar control and health tremendously. If you are diabetic, regularly checking your blood sugar levels at home can help you understand how your body responds to those meals. In particular, you want to check your blood sugar when you're fasting, so first thing in the morning before you've eaten anything. That's a great time. That will give you your baseline sugar level or glucose level. And then I always recommend 2 hours after a meal. A lot of times patients want to check their blood sugar right before they eat. Well, if you haven't eaten anything in a few hours, your blood sugar is probably going to be fine right before you eat, unless it's terribly out of control. What you want to know is how high does it get? And that can really enlighten you. If you check your blood sugar 2 hours after a meal, you'll know what that meal did to your body. And if you remember what you ate, you can look back and say, well, that rice or those French fries really raised my blood sugar, or that salad didn't seem to do too much to my blood sugar. And it can be the opposite. It really depends on the person and what is in the food that they're eating. But it can help you look back and say, well, that food I really responded well to, or that food I need to stay away from, because that's going to run my sugar up quite a bit and keep it up. So 2 hours after a meal is a great time. So if you wanted to be very hardcore and check your blood sugar by finger stick, fasting in the morning and then 2 hours after each meal would give you a lot of information. Now they have continuous glucose monitors you can wear, and you can check your blood sugar with your cell phone, your smartphone, anytime that you want to know what it is. And obviously that can provide tremendous information. But if you just want to check it a few times during the day, then fasting and 2 hours after a meal will give you all the information you need. It's a little bit different sometimes if you have to take insulin shots. Sometimes you'll want to know what your sugar is before you eat. You can do carb counting and adjust that based on a sliding scale of insulin dose, depending on how much you eat and what your sugar is right before you eat. But in general, if you just want to know how well or how bad a meal is for you, blood sugar 2 hours after you eat will tell you a lot. It's also good to know what your target blood sugar ranges are. So I always shoot for normal. I want a diabetic patient to eventually get back to a normal blood sugar level. I will tolerate a little bit higher than normal levels because I understand that they're diabetic, but the goal is always back to normal, right? That's the healthiest level without producing low blood sugar or hypoglycemia. That can be dangerous. So if you can do it without getting the blood sugar too low, then you want normal. And a normal blood sugar is 70 to 100 if you have not eaten anything. A pre-diabetic level would be 101 to 125, and then over 125 if you have not eaten anything would be a diabetic range. And I don't like your sugar ever to be over 200 if you've eaten. So, well, at any time, but typically it's going to be higher if you eat. And so you want to keep it under 200 in general if you have eaten. So fasting level, normal, 70 to 100, and then never over 200 if you have eaten. Hemoglobin A1C goal, less than 5.5 or 5.6% is normal. Pre-diabetes, 5.5, 5.6, depending on which one you look at, to 6.5%. Over 6.5% is diabetes. That 5.5, 5.6 to 6.5% range is the pre-diabetic range. And that's all right if you're diabetic. I wouldn't criticize you too much if your blood sugar A1C level is, between that 5.5 and 6.5 range. But if you can get to normal without problems, why not? If you're on medications, that is going to play a key role in helping control your blood sugar levels and can really relate to a lot of other illnesses like kidney disease, eye problems, heart disease, strokes, just atherosclerosis, neuropathy, things like that. So a lot of times diabetics will be on several medications to help combat those other complications from the metabolic syndrome. And being open with your doctor about whether or not you're taking your medications and why, talking about why you're on your medications with your provider is key. So that is a big, important step that I think a lot of people take for granted or don't discuss, but you should really be open about medications because they all can have side effects, and sometimes patients just won't take their medications, and they won't tell their doctor that because they don't want us to feel angry at them or something like that, or be disappointed with them. And they won't open up and tell us that they're not actually taking some medication we're prescribed. So be sure and discuss the medications with your doctor. They should be able to tell you why they think you should take that medication and what benefit it should have for you. And if they can't do that, you might want to find somebody else to see. But overall, again, honesty, be open with the doctor about what you're eating and whether or not you're taking the medications just right. Because we'll make decisions under the assumption that you're taking the medications just like we're prescribing it. And if you're not, we might make a different decision. So please let us know. And so another point is to maintain, regular meals. So it's important for diabetics to not have a wide fluctuation in what they eat, how many calories they eat, or how often they eat. You want to maintain a consistent meal program throughout the day. And if that means eating several small meals through the day or 3 reasonable meals through the day, evenly spaced, then that's fine. But you need to maintain consistency through that, and that will actually help you a great deal in maintaining a normal blood sugar level. Another good point is regular checkups. So it's very important for diabetics to have regular eye exams. They can develop a lot of eye problems over time. It's also important to have regular foot exams because that neuropathy or loss of sensation in the feet can cause you to have ulcers or sores on the feet that may come up and you not realize it for a few days, and then they can get infected or worse. So it's important to check your feet regularly and also to check labs regularly to see what that blood sugar, what the hemoglobin A1C levels are, to check your cholesterol, to check your kidney function. So labs regularly, foot exam, and eye exam are very important for diabetics. So I hope this helped. I hope you got something out of it. Thank you for watching. If you found this information helpful, please like, share, and subscribe for more health tips. Don't want to miss the next video. Obviously, this content is for educational purposes only and is not a substitute for professional or individual medical advice. Please discuss any medication changes or dietary changes or exercise recommendations with your personal provider.